1 year ago, the Black Scientists Task Force began a conversation to increase vaccination rates in the Black community. The group held information sessions, community outreach, and town halls to address the issue. Well, joining us live now with more on this is Dr. Akwatu Khenti, the chair of the Black Scientists Task Force on Vaccine Equity. Dr. Khenti, thank you so much for joining us this afternoon. Has any progress been made since the task force started 1 year ago?
Thank you for having me, Jennifer. Yes, considerable progress. We've helped to reduce COVID positivity rates significantly. It was 9 times the average last August. It's about twice that today. And vaccine uptake has been increased significantly. In fact, there are 2 postal codes where there's parity for second dose. It's just that third dose and child vaccination efforts are much more complicated, and we have to sort of, regroup and keep going. But public health measures have been working. Hyper-local vaccination efforts work. We've seen that. We've seen that our vaccine ambassadors have been making considerable inroads into community and bringing along community by reaching and meeting them where they are.
Yeah, and Dr. Khenti, I'm very pleased to hear that your efforts are working. It is encouraging to hear. But why are you concerned that those who are unvaccinated or not fully vaccinated, particularly, for the third dose booster shots and, as you mentioned, child vaccines, why do you think that these people will remain firm in their stance on vaccination?
2 reasons. One, social media hasn't reduce the intensity of the efforts aimed at getting people not to get vaccinated. There's a lot of misinformation circulating around fertility, around altering DNA, around conspiracy theories. And many people get their news from social media and are influenced by it. That's number one. And then in the public space, the protests have sort of signaled that public health measures need to be stopped. We've had enough. We're fed up. We want to move on with our lives. And actually, we all want to move on with our lives. It's just that we don't want to be too hasty, because the pandemic may be declining and hospitalization rates going down, but we still have 2 billion people in the world who haven't received their first dose. And until they do, mutations are not only possible, they're likely. So we have to maintain public health vigilance. The masks still need to be kept.
Yeah.
And we don't need to sort of step away from public health, because it's proven to be the foundation of our success to date.
Dr. Khenti, what are some of the issues and barriers that you see still accounting for the disparities that we see when it comes to COVID-19 positivity, the hospitalization and mortality rates, and what do you think still needs to be done to remove those barriers? You talk about these hyper-localized clinics, but what else do you think needs to happen?
PSWs need to be paid better. They need benefits. In fact, all our workers should have sick days, adequate sick days during a pandemic. We shouldn't have to fight and argue about 10 sick days. It's a minimal expectation within a pandemic, and I believe it's one of the most enduring barriers and a reason why we still have to work hard at getting under-vaccinated communities to the vaccination clinics. So sick days are one, pay is one, and of course addressing that ongoing misinformation that's coming through social media, making sure people understand vaccine science. We can't afford to have an ill-informed public anymore, because it has huge consequences for all of us. And the proof is in the pudding. We see the hesitancy, we see the mistrust. Actually, in some quarters, mistrust continues to grow. So the challenge is actually getting more complicated.
Right. And Dr. Khenti, you talk about hesitancy and mistrust, and obviously there is a very long history of mistrust and hesitancy when it comes to Black and racialized communities. Can you remind us of some of the specific examples where this all stems from historically?
So, there's the things that people cite, like Tuskegee, where Black men were denied syphilis medication so that researchers could study the sort of the path of the syphilis, or what happened when syphilis stayed in a community and how it spread. And there's also been cases like talcum powder. There's been cases, egregious examples in Africa involving some vaccinations that were done without informed consent. So those are cited widely and distributed widely. And one has to sort of take that into context, because what really drives it, I believe, is the ongoing experiences of racial discrimination, which leads many people to think, well, if they can walk into a clinic, walk into an emergency room, and be treated with so much disrespect and disdain for their pain, why wouldn't the conspiracy theories be accurate? So we have to address both the misinformation, but we also have to address the systemic racism, which is a major issue and a major foundation for the groundswell that holds some of these conspiracy theories as potentially accurate.
Yeah, Dr. Khenti, it sounds like there are multifaceted reasons as to why there is so much hesitancy and mistrust, and it's not going to be an easy job to fix this overnight. Going forward, now that things are finally reopening in the province, what is the task force's goal? Are you going to be continuing to monitor the situation in your communities and push vaccination efforts?
Absolutely. Third dose is a challenge, and we want everybody to get their third dose, adults especially. But child vaccination is a big issue. And for the Black communities, for the racialized communities, the school disruptions has really created greater educational disparities, especially for children who were ill-equipped pre-pandemic. So coming out of the pandemic, we anticipate a huge educational deficit for many, and that has to be addressed. In fact, not only must that be addressed, we have to prevent future disruptions to schooling. The data in the US is clear. Life expectancy, graduation rates, quality of life will be affected with additional school disruptions. That's why child vaccination is so important, to just mitigate that risk.
Yeah, I hear you, and I hope that you can get your message across. Dr. Akwatu Khenti, chair of the Black Scientists Task Force on Vaccine Equity. Really appreciate your time on this important conversation. Take care. Have a good day.
Pleasure to be here. Thank you so much.
Thank you.